Okay, we're now broadcasting to all the delegates for the IMTJ webinar, Medical Travel in a Post-COVID World. We're just going to wait for the numbers to push up. I can see them as they come onto the screen. In terms of the technology for this seminar, you're joining using Zoom. One thing I would ask you to do is if you go to Slido on your phone or in a browser, that's sli.do, and enter the event code IMTJ, that will enable you to submit questions to our panelists, to our speakers during today's webinar. We'd also like you to complete a poll. There is a poll running on there at the moment. Just have a quick look at that now while you're signing in. We'll have a look at that just before we start the webinar and probably again at the end, just to see what's going on. Just to gather a kind of view of the question there about how long it's going to take till we get back to kind of normality in medical travel. Okay, so we've got a reasonable attendance already. If you've just arrived, please log in Slido to submit your questions. I'm Keith Pollard. I'm from LaingBuisson. I'm also the editor-in-chief of the International Medical Travel Journal. And over the past months, LaingBuisson's events business has in effect become a virtual events business. And we've been running a series of webinars and virtual conferences in the past months across our areas of interest, which cover hospitals, healthcare, care of the elderly in the UK, and of course, medical travel through International Medical Travel Journal. So good morning to everyone, but having looked down the attendee list, I think I should be saying very good morning to those of you who are in the USA and Mexico, because it's about 5 AM there. Good morning again to those in Spain, Croatia, Germany, Poland, Turkey, and then kind of somewhere later on, India, Nigeria, Ghana, Kenya, Egypt, UAE, Qatar, Morocco, Korea, Malaysia, Thailand, Japan, and that's just the countries off the top of my list. So we have about 300 people attending today. It is a truly global audience and reflects the nature of the kind of world we face at the moment. So we are living in a virtual world. Let's just have a quick look at our Slido. I'm just going to switch screens here and see whether people have submitted a view. Let's see how okay, so the question we were asking people was for how long do you expect that the medical travel sector will continue to be affected? And people are fairly optimistic. This thing's going to sort itself out between 6 and 12 months. Okay, we'll come back to that later on. Again, slido.com. Use the hashtag IMTJ. If you have questions for the speakers as we go through, please submit them using Slido. So thank you for coming today. Many thanks to Western Union, who are our sponsor today. Western Union's business is about moving money across borders, and they're involved in the medical travel business in terms of the payment arrangements and enabling patients to move their money to destinations where they're going for treatment. So we have a truly international audience. What I'd like to do before introducing our panel is just to give you a flavour of what's happening in the UK. We'll look at your poll results again later on. Here's a BBC poll that of the UK population asking the Brits, how long do you think it will take to get back to normal? And they have been becoming more and more pessimistic. And currently, around a quarter of the Brits surveyed think it's going to take at least a year before we return to some kind of normality. From my point of view, just to give you a perception of where the UK is at the moment, here's the data that gets broadcast every day in the UK. This is our daily confirmed cases of coronavirus. As you can see, we've been through this exponential growth a lockdown at the kind of end of March that kind of flattened the curve. And then the number of cases in the country had declined steadily and are beginning to flatten out. However, it is reckoned that we have suffered 50,000 plus deaths in the UK, many of them in our care sector. So it's had a massive impact, and internationally, I think it's fair to say that the UK is seen as one of those countries that has not done the best job of managing this. I think we were probably locked down too late. We were not as well prepared for this as we should have been, and we've suffered the consequences both in healthcare and in terms of our economy. We have a mini budget from our Chancellor today, and it'd be interesting to see what he says. From a personal view, I'm speaking from home today. I haven't been in our office for months. I haven't met one of my LaingBuisson colleagues face to face for 3 months. They've just opened up the UK economy a bit. The pubs opened last Saturday, but I can't go to the gym. I can go out and meet friends now, so the rules have relaxed. And what will be interesting is to see whether we maintain the cases at this flattened level and they do fall off. The concern is we see not a second wave, but maybe a revival of cases. If we look at what's happening in the USA at the moment, that is very concerning. 31 states there that have relaxed their COVID restrictions and are seeing significant 10 to 50% daily growth in cases. So we will see where it goes. Interestingly, despite the UK having one of the worst records for coronavirus in Europe, most of Europe has now opened up to us because I think they want us to come there on holiday this summer. So we'll see whether what our colleague from the UNWTO thinks about whether the tourism business is going to pick up. What's this virus meant to the UK's healthcare system? And there's just a couple of graphs from the BBC survey that give you some of the impact of it. This is a graph of accident in emergency room visits against 111 calls. A 111 call is a call to the NHS emergency line. And people have stopped going to our emergency departments. And what has also happened is people have stopped going to our NHS hospitals. They're concerned, whereas there were, previously a hospital was seen as a place where you went to get cured. There's been a perception as a hospital was where you went to catch coronavirus. And this has caused real problems in terms of a backlog of demand, which I'll mention shortly. The other significant change is that in primary care, people have not been going to see their general practitioners, their primary care physicians. Around half the appointments in recent months have been by telephone or video or Zoom or Skype, using technology and not requiring a face-to-face interview. And I think this is something that we've seen 4 years progress in 4 weeks, that the transformation of our healthcare system in terms of adopting technology, and I think that has an impact and implications for the medical travel world. Interestingly, the UK is a significant medical travel destination and also a source of patients. In terms of being a source of patients, what we have is certainly a massive pent-up demand for elective surgery. And the big question is, where does that go once the barriers to travel are significantly reduced? It's estimated that our National Health Service waiting list will go towards 10 million people, and it's going to take a great deal of time to reduce the waiting list for things like hip and knee operations. Our dental services have been closed down for 3 months. So, people needing implants are going to have to be thinking about where do I go, or am I going to wait, even if I'm prepared to pay privately in the UK. Our private hospital sector, if you look at the big private hospital sector in London, well, around 20 to 25% of the revenue for our big hospitals in London is medical travel. It is international patients travelling to London. But those hospitals, you'll see this BBC report here, those hospitals have converted to NHS hospitals. So the way the UK healthcare system coped with the massive surge in coronavirus patients was to convert our private hospitals to NHS hospitals. So all private surgery, paid for surgery, patients with health insurance could not get treated. So there's this backlog of care needed for those. And it will be interesting to see how we recover from that. So the UK's been interesting. Where we go in the future, I don't know. Our panel today, we have a truly international panel. I'm here at 10 o'clock in the morning in Hertfordshire, just outside London. But we have 4 expert speakers around the globe. I think they're all at home. Keenam, professor from Yonsei University. It's about 6 o'clock in the evening in Korea. Michel is in Madrid, in Spain. I think it's kind of mid-morning. Sherene, she's just finishing work for the day in Malaysia. And Rahul, it's about time for lunch, probably, Rahul, in Dubai. But our first speaker is Jin Keenam. I've known Jin for some while. And if there's one destination, one country that's kind of got probably more coverage than any other in this crisis, it is Korea. And what I've asked him to talk about is how South Korea has tackled COVID-19 and what its plans are for the future. So over to you, Keenam.
Thank you, Keith, for giving me this great opportunity. In my presentation, I'd like to talk about how South Korea tackled COVID-19. Next. Next, yeah. And the first topic is the current situation of COVID-19 in South Korea. And South Korea confirmed its first case of the virus on January 20th. On February 22nd, confirmed cases hit 3 digits first time. The peak date was February 29th. Then we saw the decline of daily COVID cases. The difficult period with over 100 daily new cases were just 3 weeks. In April, the daily new cases dropped to less than 10. However, on May 10th, we had a second outbreak from nightclubs. In July, the number of new confirmed cases has stayed around 50. Nearly half of these cases were from abroad. So the domestic cases are around 20 or 30 per day. Our total number of COVID-19 cases is around 13,000. The death toll is 284. So the mortality rate is 2.1%. Next. Next, yeah. The hotspots were churches. Oh no, the previous one. The hotspots were churches, call centers, nightclubs, and courier centers. Next. Next, yeah. Now the second topic is South Korea's responses across the stages. Let me first explain the COVID outbreak stages in South Korea. The first stage, called import stage, was January. The second stage, called community transmission stage, was February. And this is the most difficult time for us. And March and April were post-peak stage. Since May, I think we are in the second wave stage. Across these 4 stages, we had to encounter with the newly emerging issues related to healthcare system. At stage 1, the issue was to enhance the preparedness of healthcare system. In the case of South Korea, 4 years ago, we suffered the MERS. So at that time, we learned a lot. So since that time, many Korean hospitals prepared. I mean, they renovated the hospitals. They also made the negative pressure rooms to prepare for this pandemic. In stage 2, the issue was to maximize the healthcare system, surge capacity. Handling the skyrocketing healthcare service demand became the prime issue. At stage 3, the issue was to increase the alertness of healthcare system. We should keep the readiness of the system. At stage 4, to promote the sustainability of healthcare system became the prime issue. Since most healthcare workers are mentally and physically exhausted by going through stage 1, 2, 3, how to sustain the system with the current available and limited resources became a big issue. Next, please. Hence, the strategy to fight against the COVID is to maintain the healthcare system resilience. The previous one, please. Yes, and then next page, please. Yeah. Can you go back to this? They remove this collaboration among people. Wow, it changed. Okay, anyway, please go to the next one. Yeah. For prevention, we quickly developed information infrastructure. We tried to provide detailed information to the public. Government has implemented the measures to provide face masks to the public fairly. The government made a contract with the manufacturers of face masks to secure more than 80% of production. The price was set at nearly $1. People could purchase 2 masks per week. For screening, we developed info-tech-based contact tracing system. Test kit manufacturers acted quickly to produce test kit even before the first incidence of COVID-19 in South Korea. We also developed AI-based monitoring system to implement the self-quarantine. Government installed an artificial intelligence calling system to more effectively monitor residents in self-quarantine. The AI checked for their conditions to see if they have symptoms and send the data along to the health officials. And for effective and efficient treatment, our main concern was keeping the surge capacity of hospitals. Hence, we developed Community Treatment Center. Community Treatment Center is the facility for monitoring the patients with minor symptoms. It is a kind of buffer zone to lighten load for hospitals. Some facilities were provided by private companies like Samsung. Next, please. Oh, this one. Across the stages, we desperately needed the collaboration of key players. We needed their commitment and sacrifice. Our collectivist culture was a driving force for this collaboration. Next, please. Next slide. Next slide, please. Yeah. And now I'd like to explain the details of some of our responses. The first one is information infrastructure. Our government tried to provide transparent information. Government tried to provide comprehensive and valid real-time information to the public. Next, please. Next. Yeah, the government developed official website to provide COVID-19 related information. Governments also hold a daily press conference. Regional alert message was sent to the mobile phone. They also developed the coronavirus apps and mask apps. Government could gain the public trust by doing these activities. This in turn resulted in people's participation in preventive actions. The underlying factor for this information sharing and public commitment was our collectivist culture. Next, please. And we developed the infotech-based contact tracing system. Next, please. Yes, and we developed sophisticated support system for epidemiological investigation. Let me explain the detailed process of contact tracing. If someone tested positive, CDC interview with the person to identify the travel route. Then CDC requested the data access permission to police and Credit Finance Association. They just use the social security number to get the information. In just 10 minutes, CDC can collect the personal information of the infected person, like credit card transaction information, phone GPS data. Next, please. This collected information is later cross-checked by the infected person. Then the travel log information is disseminated to the public by alert message to inform them to avoid the contagion area. Then the contagion area is closed and disinfected. If the infected person hides the travel route intentionally, he would be indicted. Next, please. Next, yes. Yeah. And now let me explain the testing infrastructure. We try to provide fast and secure, accurate test. Next, please. Yeah. We took the aggressive approach to testing. How many cases were tested so far? Nearly 1.3 million cases were tested by July 3rd. Next, please. Yeah, and one Korean doctor, he invented drive-through testing center. These days, in many countries, they adopt this idea. And next, please. And another Korean doctor, he also invented testing booth. And next. And we also made dispatch team for on-site specimen collection. Yeah, actually public health workers visit the on-site. And next, please. Yeah, and let me explain the hospital screening system. Next. Hospitals did their best to prevent the intra-hospital transmission of COVID-19. In several countries, intra-hospital transmission of COVID-19 was a serious problem. I draw a patient journey map to show how patients and visitors have been screened. Actually, I visited one hospital and I interviewed with the doctor over there in charge of this. And then I made this journey map. In the case of outpatients, they have to go through the gate screening place to get into the outpatient building. In the case of ER patients, they have to first should go to triage center. And after the consultation at the triage center, then he can go, yeah, somewhere. I mean, they decide where to go. Yeah, and next page, please. And next, yes. And this is the photo of gate screening place. And next screen, please. Yeah, and this is the photo of triage center. And triage center is located outside ER facility to prevent the intra-hospital transmission of COVID-19. This is the waiting area. Yeah, next, please. Yeah. And as I mentioned already, collaboration among key players is essential in the battle against COVID-19. I think one of the most important factors for controlling the COVID-19 is people's compliance with the preventive measures like, next please, wearing mask and following social distancing regulation. And Koreans, we have a very strong public belief that face mask is the only way to protect us. And also, the government supplied the public masks. They secured it. In my opinion, next please. Yes. In my opinion, one prime reason for the second wave in South Korea was caution fatigue. Several months have passed since the outbreak of COVID-19. People become emotionally and mentally drained. Hence, how to refuel the people, how to motivate them to follow the preventive measure becomes a new assignment given to the government. I hope we could overcome this COVID-19 pandemic with our wisdom and courage. Thank you for listening. Thank you.
Thank you, Keenan.
Yes.
I have a comment and a question. Interesting that in terms of Korea's approach to face masks, where it's seen as a kind of public responsibility, a duty to wear a face mask. I was listening to a lengthy discussion on BBC Radio this morning, because in the UK, it is a problem. If I go to the supermarket this morning, I would guess at best 1 in 10 people are wearing face masks.
Oh.
So people are not. It is compulsory on public transport, but you generally don't see it. If I walk down the street, it's probably 10%, if that, people wearing face masks. And I think, that's significant. I think the other aspect of your culture is how your contact tracing system, I think, would never get off the ground in many countries because of the potential privacy, confidentiality, data issues. But it is stunningly impressive. Was there a backlash towards that, in Korea? Were people worried about what would happen with that data?
Not quite. As I mentioned, I talk about the collectivist culture. Because we have a collectivist culture, and we emphasize the importance of public health safety rather than the privacy. So I think most of the Korean people, they agree with this idea, this approach. And also, the nearly 100% of Koreans, they wear masks in the public place. And one reason is, the Koreans are so accustomed to wearing face masks because, especially during the springtime, like April, we suffered the dust pollution from China. So we had to wear the face mask during the April. And so we are so accustomed to it. And also some K-pop stars and some celebrities, they usually wear face masks to disguise their identity, at the airport. And so it becomes a kind of fashion icon. So some young generations, they want to imitate their images. And so, in cultural aspect, we have Koreans so accustomed to wearing face masks. So there was no objection for it. And also, even for the tracing, we didn't have there was not quite a big debate of, violating the privacies. People agree that we can sacrifice our privacy for the public health safety.
Thank you, Keenan. Stay with us for the panel. I think the mask issue is interesting. Maybe someone after this is going to track the spread of the virus linked to countries that did or didn't support face mask use. If you look at on CNN last night, they were profiling the US states, and there's a different rule in different states as to whether you should, whether you shouldn't. There's a movement that says we're not wearing these. So culture is playing a significant, having a significant effect on the impact of this virus. So thank you, Keenan. Our next speaker is in Madrid, in Spain, Michel, Julian, and I asked, he's a tourism expert, not specifically medical travel, but his interest is in, obviously, the tourism sector. And if there is one part of the world economy that has been hit hardest in this pandemic, it is certainly tourism. So do you think, when's it going to recover, Michel? That's the question we'd like you to answer. Over to you.
Thank you very much, Keith, and a big pleasure to share this webinar with experts from top tourism destinations and also health tourism powerhouses. It's a very important topic because we are now in the phases of restarting tourism, but we have to look at the impact of COVID-19 on tourism and then see when we can foresee the recovery of travel and tourism in the post-COVID-19 phase. Next, please. Thank you very much. But before entering into the discussion, I think we have to bear in mind the importance of tourism. What happened before COVID-19? And international tourism has proven to be an important contributor to the economies of many advanced and emerging ones. If you see the graph of the share of tourism GDP in total GDP, you can see that many countries, both advanced and emerging ones, benefit from tourism. And of course, that's the contribution to GDP, but international tourism is also a large export revenue generator. It's the third trade category in the world, generating 7% of the world's total exports and some 28% of the world's total services export. And of course, it's a large job creator. We talk about jobs nowadays, and let's not forget that tourism is a large job creator, both direct and indirect, that gives many opportunities, especially and in particular to women and youth. So that's pre-COVID. Let's see what happens now. Thank you. Next. So definitely, we are facing an unprecedented situation with COVID-19. COVID-19 has caused an unprecedented disruption to international tourism, never seen before. As you can see, for the first 4 months of 2020, international arrivals, that's overnight visitors in the world, dropped by 44%. And in 2019, we had 1.5 billion international tourist arrivals. So already in the first 4 months, we have lost millions of international arrivals in the world. Of course, the first region to be impacted by COVID-19 was Asia and the Pacific. And Asia and the Pacific was also the region to suffer the most in the decline of tourist arrivals, with some 51% decline of international tourist arrivals. And this region was followed by Europe as the epicenter of the pandemic, moved to Europe after Asia and the Pacific, with a loss of 44% of international tourist arrivals between January and April 2020. Let's not forget that in April, we had a very particular situation of having 100% of global destinations with travel restrictions. That means complete or partial closure of borders, suspension of flights, so almost nearly zero activity tourism-wise. And you can see that for the Middle East, Africa, and the Americas, the performance is also negative with double-digit drops in the first 4 months of the year. Next, please. So looking ahead, and if we see what could happen in 2020 based on these 4 months results, we can draw 3 scenarios depending on the date of the opening of borders and the lifting of travel restrictions. So if the opening of borders occur in early July, we can expect a 58% drop in international tourist arrivals in 2020, a 70% if that occurs in September, and in a 78% decrease if that occurs in early December. So we expect 60 to 80% decline in international tourist arrivals for 2020. Of course, these are scenarios, and this depends on the gradual opening of border, of the lifting of travel restrictions, on the extension also of the pandemic or the possible resurgence of cases too. Next, please. So if we summarize the potential impacts in 2020, we can say that we can expect 850 million to 1.1 billion fewer international tourist arrivals in 2020. That could translate into $910 billion to $1.2 trillion loss in export revenues from tourism. And I have to mention that international tourism in 2019 generated 1.5 international tourism receipts and 1.7 trillion international tourism receipts if we add passenger transport receipts. And of course, last but not least, let's not forget about the impact in jobs. And we estimate that 100 to 120 million direct tourism jobs could be at risk because of the COVID-19 pandemic. This will put millions of lifelines at risk, and also many small and medium enterprises. As you know, tourism is comprised of about 80% of small and medium enterprises. Next, please. So if we look at previous crises and in the recent history of international tourism faced 3 major events or downturns. The first one was, of course, SARS in 2003. Well, the first one was September 11, of course, in 2001, then 2003 with SARS, and then 2008, 2009 with the global economic crisis. But as you can see on the graph, it took some 11 months after SARS to fully recover, to get to those pre-crisis levels. So 11 months means that international tourism has strong capacity to bounce back quickly and better. And it shows also the resilience. Of course, these are references to previous crises. And as we know, this is a very particular one. Next, please. So as we look at restarting tourism now, after several months with nearly zero activity, we are receiving some or witnessing some positive signs, because some destinations have started to ease COVID-19 related travel restriction. And as of 15 June 2020, we can see that according to our research, 22% of all destinations in the world have started to ease travel restrictions, mainly in Europe within the European Union area, but also destinations in the Mediterranean, some in Africa, some, a few ones also in the Caribbean, and you can see also some in Asia and the Pacific, but mainly in Europe. So Europe is leading the way in that sense. Next. Of course, we have identified some priority for tourism recovery, but let's see what are the challenges and the opportunities first. Next. There are many challenges ahead concerning the high uncertainty, concerning the unknown extension of the pandemic, concerning also the unknown extension of travel restrictions, and in a context, of course, of global recession. But there's always opportunities arising in adverse situations. And those opportunities are related to adaptation and preparation. Adaptation capacity to those potential changes in the tourism behavior. We can expect a tourist that is more responsible, that will travel at a first stage closer to home, that destinations will promote first domestic tourism, that tourist will favor value for money, and that he will have a responsible behavior. Of course, government support to the sector is key. We have seen that there has been a strong government support with fiscal, monetary, job measures to restart tourism, given the economic and social importance of tourism. But we also see opportunities to rethink the business model, to use more innovation and digitalization, and the use, of course, of data. We see also an opportunity to enhance sustainability, and I think this will be a key issue in the new normal. And we see also potential, also growth of sustainable oriented segments like rural tourism, like nature, or those products and segments connected to health and well-being. So also companies and business will need also to adapt to these new normals, with also implementing protocols of safe and secure travel. Next, please. So what are the priorities identified by UNWTO and other organizations working together with UNWTO in the restart of tourism? The first one is to provide liquidity and to protect jobs. This is fundamental. We need a strong response for governments. The second priority is to recover confidence through safety and security, and confidence is key. We need to restore the confidence of travelers to be able to travel more safely and more secure. The public-private collaboration, and our colleague, Professor Jin Kim Nam from Korea, he mentioned the importance of collaboration between all stakeholders, and this is to ensure an efficient reopening. Of course, we have to open borders with responsibility, depending on the health situation, because this is the main priority, to secure the health of everyone, not only travelers, of course. Harmonize or coordinate protocols and procedures. The coordination and harmonization also are fundamental. And of course, to create added value job through technologies. And as I mentioned before, innovation sustainability will be key pillars in the new normal. And these are two priorities of UNWTO, two priorities of our Secretary General, Mr. Zurab Polodikashvili. Next, please. This is a roadmap, and I will not go into detail, but I want you to discover this roadmap through the customer journey, how to ensure safe and seamless travel, how to reopen tourism door to door from the search and book of the trip to the arrival at the destination. So this is also important to take into account and to use also innovation and technology also to enhance the experience of the traveler. Next. We also issue some global guidelines to restore tourism in collaboration with other institutions, with the private sector, and the aim is to restore confidence for a better and stronger tourism. Next. You can find information, data, measures implemented by country in our UNWTO tourism data dashboard. So I invite you to visit the dashboard if you want recent data, if you want to know about the measure implemented by countries around the world. Next. UNWTO has been very active in the restart of tourism since, of course, the crisis, initiated. And as our Secretary General says, global tourism has never been more united than it is now. So we need to work together. I think this is a key issue. As you can see below, we have at the bottom, we have undertaking research, and we continue to closely monitor the situation and the evolution of the pandemic to see what is the impact on tourism. So we have done research on travel restrictions. We have courses and webinars and resources, and we continue to produce latest impact assessment because this is also important. The situation changes and we need to be aware of those changes, trying to track those changes to be able also to anticipate what is coming next in the new normal. Next. So that's all. Thank you very much.
Thank you, Michel. It's interesting that in your opportunities, you highlighted the potential benefits to health and wellness travel. I think you're right there. I think, what's certainly coming out of the kind of research is that the disease itself, people who've suffered from it, are suffering long-term issues, which health wellness travel may help to solve. And particularly, this is a disease that's impacted people with pre-existing conditions, diabetes, obesity, and so on. That there's a role for medical travel to play in that. I'm going to put you on the spot before I pass to the next speaker. You had three scenarios: the optimistic, the kind of medium, and the kind of this is a disaster scenario. Which one do you reckon, given everything that's going on at the moment? Are you is the glass half full or half empty?
Well, we don't have, unfortunately, a crystal ball. We would love to have it. These are scenarios. These are not projections. But I think what is important is to take into consideration what has happened so far, which is the actual data. We saw the decline in January, April, and May will be more or less also the same. So what we can say is that we try to see what are the possibilities. For example, we try to complement the quantitative approach with qualitative one. And for example, we issued recently a survey to a UNWTO panel of tourism experts to see what was their opinion about the potential recovery. And what they said is that they think that the domestic tourism will recover first than international tourism, and then that international tourism will start to recover eventually at the end of 2020 and mostly in 2021. But of course, this also depends on the possible resurgence of the virus in many countries. This also depends on the gradual reopening of borders in countries that are still affected by the pandemic.
Yeah. Okay.
These are the scenarios that are subject to change, of course.
Thank you for that. So I think there's a long way to go, and the potential resurgence of the virus is going to be the biggest challenge. So let's move to our next speaker. Sherene, it's approaching tea time, evening in Malaysia.
Hi, Keith. Hi, everyone. Assalamualaikum. Very good evening. It's approaching dinner time in Malaysia now. But we're happy to be here with you. And today I'm talking on the journey of the road to recovery, taking on from what Professor Kinam and also Michel has spoke just now. So maybe perhaps, Keith, I will go through a little bit of background where Malaysia is at the moment, a quick one. As of 5:30 today, we have, for today, we have 3 cases in total, new cases, and all the 3 cases were imported cases. So we have 0 local transmission. Our total case up till now is about 8,677. Our recovery rate is 98%, and our mortality rate is at 1.3%. So that's where Malaysia is. And considering that we are only a 32 million population country, we feel that 8,000 plus is cases is huge. But yes, when we compare to other countries, we feel blessed that, you know, we have managed to contain our COVID pandemic in Malaysia, and we hope it stays that way. So if I can go to my first slide, please. Okay, so I want to share that we are proud to say that Malaysia has managed the COVID cases very well, and WHO have complimented Malaysia's preparedness, partly because we have strong experience and foundation based on the previous pandemic like SARS and MERS-CoV. So we are very well prepared, and we have managed to deal with COVID-19 as seen in our 98% recovery. And we have also been recognized as a top 5 globally to have successfully contained COVID-19. So today we only have 3 cases, for example, and they are all 3 imported cases. And the recognition from Malaysia in terms of our Director General of Health as one of the world's top 3 doctors, and the fact that our testing is amongst the highest in Asia, as in, I think, close to 1 million now for a 32 million population. I think that's a very good rate that we have, and close to 98% recovery rate. So why I'm going through this is because in order to look into the recovery of medical travel, all these stories are actually building trust for all our medical travelers that are thinking of coming to get treatment into Malaysia. In fact, from the very first day that we had our movement control order, which we closed our borders and everything in on the 18th of March, almost every day that, you know, we have calls asking for patients asking to come in to get treatment in Malaysia. Unfortunately, we still close our borders in general, but we have started opening our borders for medical tourists recently. So if you go to the next slide, please. So you can see on the 19th of June, after 3 months of work in putting in the proposal and strict SOP, Malaysia Healthcare, led by MHTC, we have managed to convince the government that we have put in the measures to be able to welcome patients from abroad for medical travel. So 19th June, they announced that medical tourism or medical travel as the first tourism sector to be open. And if you looked at the way that Michel put in just now, you know, we had that if you open in July, what happens, September, etc. So we are trying to expedite the opening of the borders for the medical tourists. So we got our standard, the SOP for medical tourists approved at the National Security Council level on the 30th of June. And on the 1st of July, we opened for medical tourists. So we have had patients coming in, and we are still having hundreds of inquiries to date. But the SOP is so strict that every patient wanting to come in now, they will have to register with Malaysia Healthcare Travel Council. So the registration will have to come from us. We have to process it with the relevant hospitals, and only MHTC member hospitals are allowed to receive patients for now because of the strict SOP. And we will get the permission from the approval from immigration, and MHTC will issue the approval letter for the medical travelers to come in to the country. So that's how the strict the SOP is, and the patients will have to have a pre-departure COVID test done 3 days before. They will have to be tested on the very first day when they arrived into Malaysia, where they are taken straight to the hospital, and then they will have to be isolated for the next 14 days, and they will have to do another test on the 13th day before they can leave. You can see that that strict SOP has given the confidence to our government to say that, okay, Malaysia is now ready to receive medical tourists. And there are also internal SOPs being implemented in the relevant hospitals to ensure and protect these patients, as well as protect Malaysia from imported cases. Why this is important? Because if you look at how Professor Jin had presented just now, that's more or less the steps that Malaysia has taken. We actually did, you know, the tests at the currently everyone arriving at the airport will have to do the COVID test. We actually did contact tracing. Everyone of the 8,677 cases that have been recorded positive in Malaysia had been hospitalized and only released after they are proven negative or recovered from COVID-19. So when all of these patients have been hospitalized, we actually protected the public, the general public, from contracting the disease or COVID-19 in the public sphere. So, and the contact tracing was also very strict, similar to Korea. We actually traced all the contact tracing and called them in for testing as well. So that's to the level, and hence when we want to open our borders, we are very careful, and that's why we are following all these steps in terms of implementing the strict SOP for medical tourism to be opened. So next, please. So when we look into, that's the SOP for welcoming the medical tourists. But in general, in the big picture, how is Malaysia going to rejuvenate or the medical travel industry and the sector towards recovery? So we looked at the whole perspective of things, and then we realized that, you know, the main challenges are basically, you know, we have all this complete travel ban, and then we can't access our normal markets. We cannot engage them, we cannot do events, we cannot do any marketing. So what we did is that we refocused our efforts. Instead of doing events abroad, etc., we look into healthcare best practices. We look into sharing the success story of Malaysia to the target markets. We look into the continuity of care through utilizing telehealth, telemedicine, digital platforms, social media. We ensure that contact or the engagement with our patients are continued throughout this period. And then what we are putting forward to the relevant markets as well, we start looking into how to build thought leadership content through our social media, digital platform, etc. This is actually to build that strong brand for Malaysia under our campaign, the World's Healthcare Marvel. So we call it the Marvel campaign because of the success in terms of how Malaysia has been recognized as amongst the country with the best healthcare system in the world, and the quality of care that we deliver, the immediate access that we have, the cost effectiveness in getting treatment in Malaysia, and how Malaysia has managed to contain COVID-19, even though we were challenged with a big number of cases at the start. So all these are put together in aggressive PR and branding campaigns in the region, and we amplify our expertise and also the success stories, the health talks, etc., to the social media, and we ensure supporting and enabling facilities amongst our member hospitals as well as our agents in the respective countries. So now is the Marvel campaign to build the branding for Malaysia so that people will remember that Malaysia is the destination to think about when they want to come and get treatment. After all, last year, LaingBuisson has come up with a study showing that Malaysia had the highest number of volume of foreign patients, and we would like to keep it that way after the rebound. So then we look at how we want to manage the new norm, because even though we have started welcoming foreign patients from the 1st of July, commercial flights are still not open yet. So we are looking at mostly chartered flights and evacuation. And even later when we started opening our borders for selected countries, not everyone is comfortable to travel yet. So how do we work within the new norm in terms of post-COVID-19 medical travel? So that's why we are utilizing most of our digital assets in terms of reaching out and making sure that we are there for our patients. Next slide, please. And this is what we are doing now. So we're talking about digitally. So what do? We look at the regulation, we look at the best practices, what is best for patients, and then we started working with our Ministry of Health, our agencies, and also our ministries in communication, etc., to look at how best to continue to reach out to our patient and ensure continuity of care. And we also look at e-pharmacy because many of our patients also used to get medication from Malaysia. So how do we enable that even though during this time of movement control order and the borders are still closed? And of course, we do a lot of conferences and webinars to engage all our patients and also our partners in all the respective countries. So we look into all this and we want to make sure that Malaysia is top of mind with our patients and our market. Then, you know, and they will always reach out to us for their medical treatment needs. Next, please. And when you look into the journey toward the rebound, our original target for 2020 was actually about ringgit Malaysia 10 billion total contribution to the economy. So that's about 2.5 billion US dollars and about 500 million US dollars revenue to the hospitals, right? But the reality is that, as what Michel has shown just now, you know, we are actually at the middle one, the middle scenario, Michel. You know, when you're talking about the reduction, we estimated about 70% reduction this year. So instead of targeted the 2 billion ringgit, we are actually looking at only 500 million ringgit of revenue for hospitals and a total reduction of 7 billion in total economic impact. So the hit is actually quite bad for us, for medical travel, and it's worse for tourism in Malaysia. In the last 1 month, we have seen the recovery of domestic tourism, but international tourism is yet to open because we haven't opened our borders yet. So that's why now we are preparing. If you see, the Malaysia World's Healthcare Marvel campaign starts from 2020. Sorry for the typo, it's actually 2020. And then 2021, we will have the post-COVID recovery phase that we are going to do, again, stronger campaigns to re-engage our market. And we will do our Malaysia Year of Healthcare Travel campaign in 2022. So it was supposed to be done this year. We deferred it to 2022. So with this plan, we hope to have that curve at the top. If you see the curve at the top there, that's what we are trying to recover. Granted, we may not recover fully the 2 billion target that we have, but at least we are looking at about 1.3, 1.4 billion, which was the level of 2016. 2017 level. So if we can get back to our 2017 level by 2022, we will be very happy, and we are going to put our efforts, to at least aim for the 2 billion as soon as possible. But this year, that's the level we are looking at in about 500 million. And if we do nothing, we can't even reach the 1 billion figure by 2023. So all these efforts, we are looking at journeying towards recovery, and all these plans we have in detail, and all our stakeholders are now being informed of what they need to do to collectively work together as a country to continue to position Malaysia as the #1 healthcare destination in the region. So with that, thank you very much.
Thank you, Sherene. I've got a question. I'm going to save it for the panel, but I'd like you to talk to us in the panel about how telemedicine, telehealth is being applied. So I'm going to move rapidly on to Rahul. Now, for the message for people out there, if you want to get involved in an IMTJ webinar or our virtual conference that's coming up in September, then I recommend you write an excellent article and submit it for publication in the IMTJ, because that's what Rahul did. And that's the reason I've got you here today, Rahul. You wrote a very informative article for IMTJ recently, and I thought we'd close with his perspective on kind of what got you there in the past, won't get you there now, and how that's changed since we've suffered the pandemic. Rahul, over to you.
Thank you, Keith. Thank you, IMTJ, and thank you, LaingBuisson, for organizing this webinar. And thank you for giving me an opportunity to talk about medical tourism in the post-COVID world. What got you here won't get you there. I'll be possibly talking about the industry as a whole, and not for the destination where I am in. Getting straight into my topic of discussion today, if you look at the emergence of medical tourism in the past 20 years, you will see many countries try to promote themselves as a medical tourism destination, attracting international patients from various source markets for different treatment. Destination started with focusing on key specialty, an area of strength. Some promoted, I'm sorry, if you can go to the next slide while I speak. Yes, so destination started with focusing on its key specialties and area of strength to start promoting themselves as a major destination. If you look at the slide, some promoted wellness and preventive side of the healthcare, few offered cosmetic and aesthetic treatment, other positioned themselves as high-end tertiary care destination, and the rest tried their luck with a little bit of everything. However, after showcasing their strength in a particular specialty, each of these nations have also started attracting patients for other specialties. For example, India, started promoting tertiary care treatment for cardiac sciences, for oncology, for multi-organ transplantation. However, over a period of time, they have also started receiving patients for allied health sciences like Ayurveda, homeopathy, and naturopathy. Similarly, if you take example of Turkey, Turkey started with promoting hair transplantation, but now if you see, international patients come for all other purposes, including other multi-specialities into their hospitals. Next slide, please. Yeah. Now, if you look at the reason for the growth of medical tourism in the past 2 decades, it is because of the awareness which has been brought about by the internet, where a lot of information was disseminated regarding advancements of latest treatment in healthcare for treatment of various destinations and various disorders in various countries. And definitely that led to a lot of people getting interested in flying abroad, seeking better healthcare, growing population, middle income population with disposable income who were able to afford traveling outside, seeking better healthcare. That led to the growth of medical tourism industry as a whole, wider health insurance coverage, and an overall increase in travel-related activities like flight connectivity, flight options, cheaper flights, ease of visa, etc. also led to the development of medical tourism industry as a whole. So now if you look at it, these are the factors which spurred the demand of quality treatment and also led to year-on-year growth of health travelers worldwide. Of course, as the business of medical tourism, attracted limelight, it led to more and more countries and healthcare organizations entering the sector and competing to increase their share of the pie. In some countries, it was initially led by a particular organization. However, over a period of time, other major healthcare providers joined the bandwagon and started to compete with each other to promote international patients' flow into their organization. For example, in Thailand, we all know that it was started and championed by Birmingham Hospital. However, over a period of time, there are many other hospitals like IMTJ Hospital or Bangkok hospitals who have made lots of inroads into the medical and tourism space, and thereby attracting a lot of international patients into the country, and thereby being one of the the top medical tourism providers around the world. Next slide. Now, as different destinations and healthcare delivery organizations try to increase their share of the pie, some of the common marketing practices which were utilized by these destinations and organizations were a robust online presence through websites, through spending a lot of money into SEOs, tying up with lead generation companies. Some of the destinations and organizations also started their offices in source markets in order to disseminate information about their country, about their services, their hospitals, or for offering second opinion to their patients in the source markets. Few countries offered ease of access of health visas, travel, and few also bundled tourism and treatment in order to attract lifestyle health seekers, and these were the popular strategies used by different destinations to attract patients into their country or to their organization until COVID-19 happened. Now, with the world grappling with the impact of COVID-19, medical tourism business was among one of the first ones to get affected, and medical tourism activities have nearly come to ground zero. The rules of the games, as we can see, will never be the same in the future. Definitely, there will be a lot of changes, when we look at medical tourism as a business, as an industry as a whole, and all of these countries and destinations and healthcare organizations who have tried to promote themselves as a major medical tourism destination may have to go back to the drawing board and may have to start competing with each other once again, keeping a lot of other things in mind. And that brings to my next slide. To give you an example, now, a lot will also this time depend on, a patient's expectation and patient perception on how well and fast a country has emerged from COVID-19. And my previous panelists have already talked a lot about what their countries have done to come out of and to bring normalcy into their countries. So if you look at the UAE as an example, UAE is getting back to normalcy with lesser number of COVID-19 cases being reported every day. UAE has also been lauded for performing one of the highest number of COVID testing per million population. And I want to reiterate, UAE has done 3.7 million COVID testing in a population of 10 million. And that is, I would say, one of the highest, or maybe, could be compared to the best in the world. Again, UAE's recovery rate has also been one of the best compared to global average. It has seen about 80% recovery rate in these COVID cases. And for your information, and that is why, Dubai has almost returned to normal. And from yesterday, its airport has started opening up, receiving international tourists from 50 destinations. Emirates Airlines Fly Dubai has started flying to 50 destinations for now, and we have started receiving international tourists into the Dubai airports, and we are hoping that Abu Dhabi will follow the suit very soon. And with international tourists, we are also hoping very soon we will start receiving medical tourists as well. Now, for any country to start witnessing or start treating international patients, obviously we need to, a lot will depend on how much healthcare infrastructure is available in a country to treat its own patients for chronic disorders, for life-threatening disease and lifestyle disease. And to that effect, UAE's health regulatory has done a commendable job of coming up with a concept of COVID-free hospitals for private healthcare providers. And this has been done in keeping in mind to create enough capacity, enough spare capacity to treat its population for non-COVID reasons. Now, in order to certify hospitals for as a COVID-free hospital, procedures involved was discharging the last patient who were admitted in the ICU, which were having moderate to critical patients, conducting thorough sanitization and adhering to the highest standards of infection control. And then there was a very a detailed inspection of these facilities, after which they were announced as a COVID-free hospital. And this was done, as I again said, to create enough facility for people within the country, and also eventually to start seeing international patients, as these facilities will not be seeing any COVID positive cases. These facilities, which are certified COVID-free facilities, will not be treating any positive cases, and these positive cases will be treated at a designated facility created by the government. And lastly, in addition to this, now international patients will also start choosing a particular destination or a country or an organization where they understand that there is a civic sense of continued social distancing. Jin already spoke about wearing mask as a culture, which is very important. And international patients will definitely look at destinations which understand these norms, the new normals, personalized treatment in a less crowded environment, where there is an infrastructure, where dedicated living space or a public transportation is available, multi-cuisine eateries are readily available in a safe and hygienic environment. So, going forward, definitely international patients will also start looking at all these smaller things, apart from what they used to look at in a country, like the software element or value for money treatment, or any other SOP, or the values which they used to look at before they chose a particular destination. Next slide. Now, talking about some of the medical tourism trends which medical tourism industry may witness post-COVID, globally. To start with, the new visa policies might come into place in various countries. We may see various countries requiring COVID negative certificate till there is a COVID vaccine available. And once there is a vaccine available for COVID-19, we may see many countries starting to demand a vaccination certificate from a designated institution, just as we see in the case of a travel to and from yellow fever affected countries. Secondly, we might see emergence of regional medical tourism hubs. When I say regional medical tourism hubs, these are the smaller countries with better healthcare infrastructure, which may prove to be an alternate choice to its neighborhood population, as these countries may start attracting patients who may not want to travel longer distances and want better value for money and quality treatment. For example, if you look at Kenya, we may see Nairobi attracting larger number of patients from its neighborhood Eastern African nations. And similarly, if you may look at Sri Lanka, for that matter, it may start attracting larger number of patients from island nations like Maldives and Seychelles. And that is where I see, these regional medical tourism hubs start getting, starting to strengthen their place in the field or in the industry itself. The third trend which we are already witnessing is the trend that more and more such live CMEs and knowledge sharing sessions have already started happening over webinar. This happens because of the ease of organizing the knowledge sharing sessions, the cost effectiveness of the same, the wider reach and participation from larger audience, and that is why we may see more and more webinars happening and taking place of a live CME. And the last trend, which is one of the most talked about the trend, and a lot has happened in the last 3 months, the trend of telemedicine and teleconsult. These technologies have been around us for a very long time, but very few have exploited its advantages in the past. Now with the COVID-19 situation emerging, we are seeing more and more healthcare organizations trying to get onto such remote medical tourism, remote healthcare delivery platforms like telemedicine. Many players have already started acquiring different tools and started connecting with their patients remotely. And to a large extent, telemedicine will be a very big advantages for follow-up patients and for chronic care patients, where there will be no routine, where the routine visits can be avoided. And this can also prove to be a parallel revenue source for medical tourism companies and healthcare organizations. And that brings me to my last slide. Now, my co-panelist, Michel, has already talked about the expected timeline of recovery of of tourism. I just wanted to give you a little bit of a heads up of how I see, recovery of medical tourism in times to come. Where phase 1, as I see, is a phase of international travel resumption. And this is a timeline of 1 to 3 months post-travel ban. And at this time, we may start seeing some of the critical cases, some of the cases with life-threatening disorders, and like, for example, cardiology, oncology. And interesting so, since Dubai announced that Dubai will start receiving international tourists from 7th of July onwards, we have starting to see increase in numbers of cardiology and oncology cases, inquiry of cardiology and oncology cases in our systems. And this is the time when most of these chronic cases might continue to be at their bound to be homebound and take care of themselves rather than travel at this point in time. Phase 2 is a timeline of about 3 to 6 months post-travel ban, when we may expect some kind of vaccine or medication, confirmed vaccine or medication being invented for COVID-19. And this is the time when we can expect some rebound in lifestyle healthcare seekers, IVF seekers, IVF patients, and this is a time which we may see a gradual increase in the number of different mix of patients starting to travel. And that brings me to the last phase, which is the phase where there will be a lot of confidence build up in the business and leisure activities, and that will bring to international patients seeking starting to travel to different destinations seeking healthcare. And this is a timeline of about 6 to 12 months post travel ban. And being most optimistic at all times, I would say this would take about 1 year for medical tourism industry to be at its pre-COVID level, is what I see things as we see as at the moment. And I think that brings me to the end of this presentation. Thank you so much.
Thank you, Rahul. We'll now spend about 10 minutes on questions to our panel. We've still got good numbers here. Not many people have dropped out. Just if you can't stick around for the panel, I just want to give a quick plug to our major online event for IMTJ, which is happening September 23rd, 24th. You can register now. The Medical Travel Summit 2020, which was planned for Madrid this year. Things are still remaining too uncertain, but we will be running a virtual conference in a virtual conference environment over 2 days with lots of opportunities to interact and get involved. Again, before some of you leave, I just want to say thank you again to Western Union for sponsoring this event. So let's move to our panel. I'm just going to switch to our questions. And let's just have a quick look at our poll and see what the end results of that. So people are fairly optimistic, I think, like you, Rahul, 6 to 12 months before we try to get back to some kind of normality. So let's take a look at our questions. Before I go to these, one for you, Sherene, and it's about, Rahul mentioned telemedicine, telehealth. Is that going to change? There's been kind of 4 years development in people's adoption of online stuff in 4 months. Is this going to radically change the way that you deliver services to your international patients?
Thank you, Case, for the question. Thank you, everyone. Actually, for Malaysia personally, we had been lagging in terms of adopting technology previously, and I think the period of COVID pandemic has forced us to be adopting it a bit faster. And I think in terms of policy and regulation as well, the government has relaxed a lot of things to enable more adoption and also into digital spheres. And in general, if you look into healthcare, we are the least disrupted industry. So now I think it has forced us to embrace technology in terms of engaging our patients and making sure that they are cared for, and looking into, like, for example, even e-pharmacy, etc. So yes, I feel that it has helped. I mean, the telemedicine, telehealth, teleconsult, e-pharmacy, they have helped in terms of engaging our patients, not only for medical travelers, it's also for our domestic patients.
Okay, I'm going to pick another question. This is from Lindsay Wang, who runs a business focusing on Chinese patients in London. And this thing about who's going to benefit and who's going to suffer from what's happened in the pandemic, and your view, Michel, from the tourism point of view, is this going to be a big factor in how people's perceptions, consumers' perceptions, going to change, whether it's tourism or medical travel, of a country's performance in dealing with the pandemic? Michel, could you comment on that one?
Yes, thank you, Keith. Well, I will not think about losers and winners in this situation, because I think we are working together to reach a common objective, and it's to restart tourism in a safe, secure, and responsible way. And to reach that goal, we have seen that many countries are implementing protocols. I think protocols will be key to restore confidence and trust, as Sherene mentioned. I think that will be a fundamental issue if you want also travelers to be confident again and motivated also. So protocols, hygiene ones, safety ones, security ones that can minimize the risk of the spread of the virus and protect health at the same time of the citizen or the traveler. So I think the protocols will be key in that sense. And of course you have certifications. Many countries are also implementing, certifications. You have, for example, in Portugal, certifications of safe travel destinations, safe and secure. And that's also very important. The use of apps to trace also, as Sherene mentioned, and all colleagues here at the webinar. The use of technology will also be key to ensure a seamless experience.
Okay. Keenam, and I'm going to ask this of both Rahul and Sherene. There's a few questions here around the ideas of certification. I want to ask specifically about certification protocols within hospitals that are delivering services to international patients. Is your country establishing a set of standards that a hospital must follow to serve an international patient following this? Keenam first. You're muted, Keenam. Keenam, could you unmute yourself?
Yes.
You're on.
Yeah. We made the hospital certificate system, and also actually our government made several certificates. The hospital, we evaluate the hospital's readiness to serve foreign patients. Actually, we adopted this system 2 years ago, but so far, around 10 hospitals and clinics have passed this criteria. Okay. It is a very high, standard. It requires a high standard.
Okay.
And also,
Rahul, Dubai Health Authority, the regulation is quite tight on international hospitals. Is that changing post-pandemic to make it even tighter in terms of who can handle these patients? You're muted, Rahul. It's that classic comment in a Zoom call.
Yes, DHA is as strict as ever, and they are taking one step at a time, and they are going facility by facility and doing a very stringent, kind of inspection in order to give them, complete protocols of what should be, made available and what should be done in order to, minimize the chances of infection, and how to screen a patient, and in case if it is found positive, how to segregate those patients and not let them mix with the COVID-free patients. And yes, DHA is going very strict on that one, and very few healthcare organizations have been able to achieve such certificate for now, at least.
Sherene, I imagine your country is well on top of this.
I'm proud to say that we have the SOP that has been approved by the National Security Council. The protocols include that only hospitals that are members of Malaysia Healthcare Travel Council can handle foreign patient at the moment, because these are the hospitals that we know that they have the strict protocols being implemented in their hospitals. So in a way that MHTC, we are taking the responsibility to attest to these hospitals. So that's about 70 hospitals out of 260 private hospitals that we have in Malaysia. And yes, to answer the question that, whether we should have a COVID negative statement, tests coming in. Yes, for us it's very important, because as I mentioned, currently our cases, like as today, 3 cases, and they are all imported cases. So you want to make sure that you don't have 0 case. And that's why we need patients to be tested negative 3 days before and tested again upon arrival to make sure that they are COVID negative.
Okay. One last question for each of you. Question from Dr. Rashk here. Is there a possibility of a major paradigm shift leading to close by countries emerging as winners? So I think what you're saying here is, okay, tourism and travel is going to recover. Domestic tourism recovers first, but when people travel, they're not going to travel as far. They're going to be, in terms of confidence, I'm not going to travel globally. I'm going to travel much more locally than before. Is that a reasonable view to take? Michel, what do you think tourism? What's your view on tourism generally in that sense? And unmute, please.
Keith, are you talking about the question in yellow?
Yes, the question is, will people travel but not travel as far? So they're going to stay very much within their own region or within their own country.
Well, that's a trend we are witnessing. And I think, it's a step-by-step process of reopening borders after several months closed, implementing the protocols, and restoring confidence. So this will be a trend in a first stage to travel, for example, within the country and to the region, itself. We have seen the same pattern also in other crises.
Yeah.
So I think this will be also the pattern in this one at a first stage, of course.
Yeah. Rahul, would Dubai become a regional centre? Is that what it's focused?
Exactly. So I was coming to that point. I think this question has been addressed on that topic of regional medical tourism hubs. And as Michel just said, I think regional medical tourism definitely will, emerge because of the fact of less travel time, ease of obtaining visa, and obviously, patient would not want to travel as far. they would definitely look at how they can get better healthcare in a closer by destination. And that is when I gave an example of few countries, including Kenya, including Sri Lanka, possibly Uzbekistan might start attracting its neighborhood CIS population. And similarly, different other countries which might see a neighboring population starting to flock into a particular country because for the fact that they might not have to travel very far seeking healthcare.
Okay. Okay, last question, and I'm going to fire this at Keenam and then Sherene.
Yes.
And the question is, how does a patient determine whether a destination is safe? So put yourself in the patient's shoes. Should I go to Korea? Should I go to Malaysia? Should I go to Dubai? How's the patient going to make that decision, do you believe? So firstly, Keenam, and then the last word from you, Sherene.
Okay, and I think we have seen some clinical outcomes like number of COVID cases and mortality rates, and also how the healthcare system responded to the pandemic. So we, the people across the world, they have seen and the outcomes, the reactions, and so I think they can, make their decision based on these informations. And so, the hospitals and healthcare providers in the medical tourism market, they should try to send a strong message that, their system is was effective and also safe. And they should stay connected with their potential customers and patients. Yeah, they should send a strong message.
Sherene, how will you convince patients that it's safe to go to Malaysia?
I think that's precisely what we are doing at the moment, Keith. All that we are doing now is actually engaging patients, educating them how safe Malaysia is, and in terms of how we have recovered or we have contained COVID-19. And how we had a 98% recovery, low mortality, all that, and all the SOPs are actually the protocols that we have put in place are something that will show to them that we take it seriously to keep not only patients safe, but also our healthcare workers and Malaysians in general safe and protected from COVID. We do get comments from our potential patients coming in saying that, oh, too many, we are too strict or too cautious with our protocols. But for us, this is what instill trust and give them the confidence that Malaysia is a safe destination. Another one that I want to add on is that to the question before is that a destination also can become the beneficiary because many of the destination originating countries, they have people suffering economically from COVID. So they are now looking for also value for money or affordable destinations. And I think destinations which are safe and affordable would be able to gain advantage and benefit from the current situation. That's my humble opinion.
Thank you, Sherene. Okay, we'll close this morning's webinar there. Many thanks to all 4 of our participants. Many thanks to all of you around the world who stuck there. The numbers have stayed pretty solid. So thank you, panelists. You've obviously shared some great insight with our audience. Just a reminder to finish off that if you want to come back to the virtual world of medical travel, you can do that in September. You can register now. Over 2 days, we'll be featuring contributions again from around the world. We will be working on UK time because that's my time. But many thanks. Please sign up now. Please take a look at IMTJ. Over the last couple of months, all we've written about is COVID. It's about the only topic there. And let's see in September whether we've got back to any sense of normality. So thank you to the attendees. Thank you to our sponsor, Western Union. And thank you to all those of you around the world involved in medical travel. Stay safe, stay healthy, and let's hope our business recovers in the not too distant future. Thank you for your participation.
Thank you.
Thank you, Keith. Thank you.
Thank you, IMTJ.
Thank you.